Hi students, next clinical scenarios from OFT, that is organ function test, to LFT, liver function test, jaundice. We have three types of jaundice: hemolytic, obstructive and hepatic. The first and foremost repeatedly asking is obstructive jaundice. So the clinical scenario is like this: clay colored stool. Why? Severe abdomen pain is present. Why? Jaundice is present. Why? What is the bilirubin level? Like that. Bile salts and bile pigments present, whereas urobilinogen absent. Why urobilinogen is absent? Where it is synthesized. Like that, the clinical scenario will be having for obstructive jaundice. Second one is Vandenberg test. With this test only, we can identify the obstructive jaundice, that is direct positive. Initially, the color will appear means obstructive jaundice, that is direct positive. Then total bilirubin level is elevated, liver enzymes also elevated. These are all the manifestations and biochemical picture of obstructive jaundice. Coming to the hemolytic jaundice, usually newborn, sometimes after 3 months of birth, 3 days birth, 3-day old baby. Sometimes treatment is phototherapy, and mother is having blood group like A, father is having RH incompatibility. Like that, the clinical manifestations are in our clinical scenario. Coming to the biochemical, Vandenberg test is indirect positive, whereas obstructive jaundice direct positive. Here, indirect positive. Suppose in your clinical scenario, Vandenberg test is indirect positive, means the diagnosis is hemolytic jaundice. RH incompatibility in your clinical presentation means diagnosis is hemolytic jaundice. Like that. Okay. Here, total bilirubin is elevated, conjugated bilirubin is mild elevation. This is very, very important. Conjugated bilirubin is mildly elevated, whereas unconjugated is very high. 10 times, 100 times it will be elevated. These are all the points related to hemolytic jaundice. Coming to the hepatic jaundice, Vandenberg is biphasic. This side or that side, like that. Here the bile salts is negative initially, after that positive. Bile pigment is always present. Urobilinogen is positive, and total bilirubin and liver enzymes are elevated. So these are all the points suggestive of hepatic jaundice. The problem for hepatic jaundice is initially it looks like normal picture. After that, the picture looks like obstructive jaundice, like that, right? So we have three types of jaundice: hemolytic, obstructive, hepatic. In these three, hemolytic and obstructive is very, very important.